This is a story of 1982. Long time back. There was one patient with chest pain. He had persistent chest pain. Troponin was positive and ECG showed biphasic T wave in V2 and V3. There were no ST elevation, no ST depression. Just there were biphasic T wave in V2, V3. Since his symptoms was not resolving, he was transferred to cath lab, and in cath lab they found proximal LED occlusion, total occlusion. So afterwards they started studying that pattern of ECG, and later they called it Wellen pattern. And if it is associated with chest pain or cardiac ischemia symptoms, then it is called Wellen syndrome. So it is of two types, type A Wellen and type B Wellen. So type A Wellen means just I told you biphasic T wave in V2, V3. But type B Wellen pattern is if there is T wave inversion in all precordial leads. That is called type B Wellen, and that has also more than 80% positive predictive value for LED occlusion. So high positive predictive value. So if T wave is inverted in precordial leads, then you should also be suspicious of LED occlusion, particularly if there are symptoms of cardiac ischemia. And in earlier video I talked about De Winter T wave, where there is peaked T wave. There is ST depression followed by peaked T wave in precordial leads. So do not only see ST elevation, ST depression, but also check T waves, whether it is biphasic, whether these are inverted in the precordial leads, because these also suggest you infarction, and these are not ordinary infarction. This is equivalent to STMI, and you know LED is one of the major coronary artery. If it is occluded, you can imagine a large part of the ventricular wall get infarcted. So what are the ECG pattern in LED occlusion? One is definitely ST elevation. ST elevation in the precordial leads. Another I talked about ST depression followed by De Winter T waves. Then biphasic T waves in V2, V3, and another is T wave inversion in all the precordial leads. And another is, do you remember? Have I missed anything? Can you tell me what is another ECG pattern that you think, if it is present, then you should be suspicious of proximal LED occlusion, especially if patient has symptoms of cardiac ischemia? Yes, LBB, left bundle branch block pattern.